Hi, I'm Dr. Puneet Gupta from the Hunar clinic. I'm here to answer your questions by means of this short video. Hopefully you'll find it useful. One question which is often asked on different types of liposuction, and I think there is a lot of confusion out there understanding different types of liposuction. Although it's a minefield on its own and can take a whole day to explain and go into the details of it, but I'll try to summarize without making it too boring for all the viewers. The best way to understand is to break it down into what kind of anesthesia you're going to use, and then that can lead to what type of liposuction can be done. Broadly, there was a traditional way doing it under general anesthetic, which is effective and it's still done in some parts of the world, but of course is slowly gone out of fashion. Patients don't like to be put under general anesthetic because of the obvious risks and complications involved. So that led to invention of a very useful local anesthetic technique called Tumescent anesthesia by the legendary Dr. Jeffrey Klein from California, USA in 1985. And that has transformed the art of world of liposuction and has made it safer than ever before. Tumescent liposuction, tumescent anesthesia basically involves injecting large volumes of local anesthetic solution in pockets of fat that you want to remove. This leads to very effective longer acting anesthesia. Everything goes numb, patients don't feel anything, but this also achieves a good hemostasis. Basically means the supplying blood vessels to the area are shrunken, which minimizes or almost eliminates any blood losses that has been a problem in the past. And it also helps swell up the fat cells, loosen it up, and make it easier to come out. So it was a master stroke in a way which allowed, which taken care of all the problems of the past and allowed practitioners to apply newer methods, and now one has to just go in and remove the fat. So that's the anesthetic side of it. Now in terms of different types, different ways how you can remove fat from the area, can possibly be divided into maybe energy assisted liposuction, where you would involve some form of energy either by ultrasound or laser or radio frequency to help liquefy or break down the fat, and non-energy assisted, wherein you simply go in and remove the fat. Energy assisted liposuctions, there are so many different companies offering their own treatments, although they are all effective, but as you can understand, it's probably a little bit unnecessary because tumescent anesthesia has basically prepared the area for you, and all one has to do is remove the fat in the least invasive manner. Having said that, energy assisted devices can actually increase your recovery times, can put you at risk of side effects like skin burns, seromas, longer recovery periods. So none of that is required technically. Once you've applied tumescent anesthesia, then you could very easily move now to non-energy assisted method, which is also invented by the legendary Dr. Jeffrey Klein, using microcannulas, and these are one of the most revolutionary techniques that I have worked with. But to sum it up, you could have energy assisted, non-energy assisted forms of liposuction. You can have it under general anesthetic, you can have it under local anesthetic with minimal side effect and complication. If you want to know it more, if you want to know what suits you the best, come see me for a no obligation consultation, and we'll be able to discuss it in more detail and make sure you understand what's best for you. I hope you enjoyed this video and it answered your question. But if you still have any further questions in your mind, please do not hesitate to get in touch with us either by email or by calling us, social media. Thank you.